Good afternoon, everybody. This is Janelle Pecano with the Ohio Department of Mental Health and Addiction Services. Also joining me this afternoon is Rob Nugent with the department. We're both in the Office of Licensure and Certification. I want to thank everybody for participating in today's technical assistance webinar. As the same format as past sessions, we'll go over a few questions that were submitted in advance, and there really are only a few this week. You may also submit questions in writing on your control panel. You have a questions box. You can click in there, type in your question, and hit send. We'll receive it here, read it off, and answer the question. And then if you would like to ask a question or speak when we're done with the written questions, you can, on your control panel, there's a box for you to raise your hand, or a little icon, I guess. If you hit that, I can unmute you, but you do need to be connected to either using, have a microphone on your computer, or you're connected over the phone, or you have a speaker and headset. So with that started, we're going to go ahead and begin the questions. We have been asked, this is not on your slide, to get the technical assistance PowerPoints up on the website, and we're working to get that done. Hopefully they'll all be available this week, and maybe a little bit later I will show you how to, where we hope to have those posted. So I'll show you that. It will be where the Health Home application is. We've also been asked how many agencies have either submitted applications so far, or how many are still intending to. And we haven't received any Phase 2 application yet, so we don't have any yet. We know that providers are still working on those applications and getting them ready to send to us. We're not sure of what the numbers of providers that intend to still submit a health home application. We're asking providers on the webinars, people who sign up, we ask that question, but that's not necessarily a representative sample of everybody. So we just don't have that information. So the first question was about, or multiple questions about sort of the date of applying for certification, and we've been asked, does the agency have to submit an application so that it can be certified by October 1st, or is there any penalty for not doing so? And the answer is no. Health Home Service will become eligible in Phase 2 for billing Medicaid for the service on October 1st, but as with any OhioMHAS certified service, an agency can add it at any time. I've been asked a question about Table A, asking for the, there's a Table A, asks for the name of the primary care provider in the column. And then the question is, if you're submitting an application, do you have to list each provider, a specific physician, or that could be a certified nurse practitioner or whoever, or can you list the organization? And the answer to that is just list the name of the individual or entity with which your organization enters a contract to meet the requirements of paragraph E of the rule. And I've got the rule here for you. And there's paragraph E, that's the proposed language, which was filed with JCAR to update it. There's a little bit of proposed change in E2A, and then there's a new E3 there. But in the previous question, E2, and I put that in purple since the black and blue and red isn't enough colors on one page. That's where if you're going to enter into an agreement doing a co-located or on-site or collaboration model, you have an agreement. And then there I'm showing you the Table A where it says the name of the primary care provider or providers if not integrated. So by asking for provider or providers, we're not asking for the specific staff members of an organization. If it's a primary care practice in your town, you would list the name of that practice. but you might have a couple of different, 2 or 3 different agreements based upon what your population needs might be, so you can list each one, but you don't have to go to the level of detail of all the staff. So I've been asked if a health home can limit its provision of the services to a particular segment of eligible enrollees. For example, kids, and I guess I have for example twice there, e.g., and then at the end, kids with asthma. And a client, and the client rights has the right to participate in any eligible and appropriate service. So if you're going to become a health home provider, the expectation is that that provider, or that service is available to persons in your agency who are eligible to receive the service. I have, that was also covered in Phase 1 in the State Plan Amendment, and so I have sent an email to our Office of Health Integration to confirm that that is still the same in Phase 2. If that is different, I will let people know. And I need to get, right here I lost my webinar service, so let me get that back. And then the last, just have we scheduled more TA sessions? And the last week I took a poll during the TA and asked whether people preferred them every week or every other week or once a month, or didn't need to hold them anymore. And for those, some couple people felt we didn't need to hold them, and obviously that's fine. People don't, don't need to register, although they're more than happy to do so. So in the ART, half the people thought every other week, and it was pretty close on still once a week. So in the art of compromise, I thought we'd go, obviously, today and the next 2 weeks, and then the last 3 will be every other week. To get it as, we do anticipate the health home applications as people start submitting them. There might be less need, but we thought it's helpful to get on our schedules and for providers to get the time blocked on their schedules as well, so that we can be available if needed. Have received, they do start at 1 o'clock. Note that time change there starting next week, and realize that that is not, maybe some people might find that time difficult. We're trying to coordinate a lot of different schedules here, so we needed to move that up to 1 o'clock. We will try to get in addition to the PowerPoints, try to get the actual webinar recordings in. My understanding is it's been working a little bit better. I've switched to actually holding this in my office, and that the audio is better and the visual is a little bit better. So at that point, I'm going to start. If you have any question you want to send in, feel free to type it in, and we'll start answering those. So the first question, it seems that the transitional care requirements for care planning may be removed from the rule. Does this affect in any way the comprehensive transitional care information being asked for on the application? Or is this proposed rule amendment specific to care planning only? And Joe, if you're asking about some language, are you asking about some language that's in our proposed rule? And if you can just maybe start from there and send that to me via the question pane, or because I'm not sure in our proposed rule what this would be about. Let me get over, well, if you want to provide some more information, let me also get over to the proposed rule. So you're referring to the notice of public hearing. Take me a minute to get over. All right, so I'm going to go pull up that. I've got the rule available to show, but let me go. If you're at any time when you're looking for rules that we have were either new rules or amended rules, you can go to the department's webpage under regulation. You'll see there at the bottom rules, and then there's a link pending. That takes you to the Register of Ohio. And if you click on the particular rule, there's the information. And Joe's also a little faster than I am. Remove transitional care planning from requirements. All right, thank you, Joe, for that. We have, let me go back over to the rule. So the answer to your question is no, the application was actually amended based upon the rule that was filed. So any places that we have proposed amended language in the rule, we've already filed that. Let me make everybody can see this. Okay. One more page here. And so you see there at the top, paragraph C is lined out. So we're proposing to eliminate that. So it's more the requirement if somebody is in, for example, if they're in the hospital, it's the hospital's requirement to sort of develop that plan. So we took that out, but we have already amended the application to reflect this change. And there were 2 or 3 different bullet points on the application that don't exist anymore. And so I can't show you something that doesn't exist. But, so hopefully that helps. Okay. Question, can we talk more about the partner-provider outreach engagement? Let me try to pull that up here on the application. I think it should be on your screen there at the bottom. It's partner-provider outreach and engagement. So you're required to develop an outreach, an outreach plan. And what you're doing in this particular section is engaging with different community members or other providers on health home service. What's going to be their role? How can they participate? How information is going to be exchanged? When you have, this could be, sorry, I'm suddenly drawing a complete blank. It is Monday. So this could be working with maybe some pharmacies or perhaps specialty healthcare providers. It could be any, as part of your health home service, you're going to identify who are the partners that you need to be working with. And health home service, it's a new service. If we all think back to, and I'm including myself in a big way in this, and my knowledge of health home service, 18 months ago, and then 12 months ago, and 6 months ago, it's new, it's learning, it's evolving. In the community, people aren't as familiar with it. If you're involved in healthcare, I think people are starting to see more and more articles. But how can you help people that you're going to work with understand the service and what their involvement is going to be? So hopefully that's helpful. If not, let me know, and I will try to expand on that a little bit more. Those are the last 2 questions right now that we have in writing. So I'll take a moment and let people, have a moment to, if they have anything else that they want to come up with. I've got nothing coming in. There's always like a dead time on the radio, I guess. But all right, I thank people. Again, there's the link for future dates. There's also the ability when during registration, if people want to type questions in then and have them submitted in advance. I was able to get the registration changed for this next set to include that. So we'll try to pull those off. I hope everybody has a wonderful week. Hope the weather's great here. I hope it's great throughout the state. And we will see you. Okay, I've got, all right, now the questions are coming in. I think one person's already ended. Question, can we only do one tier? And that is related to your population data. That would be a question for the Office of Health Integration. And another question, do you have to submit a financial model with the application, or can that be submitted later? The application, you have to submit everything that is asked for on the application at that time. That should be sent in with the application. Over here on the department's webpage, and I've just switched to where the application is, there's a application resource document. And that lists every attachment that needs to be submitted. I don't, when you talk about financial model, I'm not quite sure what you're referencing, if you want to clarify that. But if it's on the list, which we'll download perhaps by the time this webinar is done, then it needs to be submitted with the application. And if it's not on the list and it doesn't, so there's no specific request for a financial model. So Lori, if you want to clarify that. Another question, are there dates yet for the quality and financial webinars you have referenced in past sessions? My understanding is no, but I have not spoken with anybody in the Office of Health Integration over the past couple of working days, and AFET couldn't be with us today. When those dates are available, they'll be sent out. And there's a question on the health home service population. Are you just asking for agency demographics since we do not know who is on the list from the state? And that is a question to Section 2 on the application, which I have. Health home service population. Agencies, you were provided your de-identified population data. If you're having difficulty with understanding it or how to interpret the data, then I would encourage you to contact the Office of Health Integration. One of the things that was mentioned last week is there were problems with their general email box. So you can go ahead and send, a lot of people have been sending emails to Rob Nugent, and his email address is on the last slide presentation that you were sent out, and he will get those forwarded on. If it's just about that, and some people send questions, some of them are for licensure insert and some for health integration, so he just forwards that on. There's a question, will we reject an application if the integrated model does not match the Tier 1 service rate of $215? The information that's provided with the application is going to document your agency's ability to meet the health home service requirements. The rates are part of rules for the Ohio Medicaid rules. That is separate. If an agency puts together a model and you're meeting the requirements of the service, then we will certify you for the service. The rates that can be billed for are part of the Ohio Medicaid billing rules, and that's not part of licensure and certification process. Are client signatures required on any forms other than informed consent? You would want to have your clients involve the clients in the treatment plan, and you would have to document that. Even under certification standards for other service, in ISPs and ISP reviews, what we look for is documentation of their participation. That can be signature, that can be progress note, that can be, it's flexible for how the agency wants to document that, and that's good clinical practice. Mike, you're asking, are there any documentation requirements? I don't know if you're just talking about the general documentation requirements. Obviously, when somebody comes in, you have to provide an orientation, and you'll want to document that. You'll document informed consent. You'll be documenting your comprehensive assessment and your development of your care plan, and then you're required to document the delivery of the service. There is in the Ohio Medicaid rule a reference to the documentation to do it. It's not part of a licensure and certification rule. So again, they wanted to be flexible in how agencies document their delivery of health home service. And again, right now, that's the last question I have. Just waiting a moment to see if anything else comes in. And I think sometimes there might be, sometimes there's a little bit of lag. They usually come pretty quickly. Okay. Other than that, I'll try to, for next week, I'll try to have, see if there's any new information or that I'm better informed on dates for the quality, the other webinars that are on health integration. I know, like I said, I know they've been pretty good as soon as it's available, sending out the emails. I'm personally a little bit behind in emails. I haven't seen one. I'm assuming if people have asked, but it hasn't gone out. At this time, the information that's available to agencies from the website is the de-identified data. That's what's available at this point in the process. They're working on business associate agreement. When those are executed, agencies will be able to get identified data. And if you have more questions on that, please contact the Office of Health Integration. And I hate to feel like I keep sort of referring to that, but we're, this is part of the licensure and certification process. It's meeting the rule requirements, but billing and all of that is handled by somebody else. I just don't have that information, and we're trying to keep so that people can be efficient in their participation in webinars, that if we have the topic of the webinar, and then people can choose what webinars to participate, what information they're looking for. And then there's a question, do you document each service interaction with the progress note since it isn't billed by interaction? I know you mentioned Medicaid rules. Let me see if I can get over there quickly and find that language for you. And again, this is not going to be a licensure and certification rule. It is going to be an Ohio Medicaid rule. And I'm going to have to, it's in one of two rules, I'm not sure, so hopefully this is the right one. And I realize that there's the rules that contain the rates, and we're not going to entertain any questions on that. If people have any questions, they can address those to Ohio Medicaid. Okay, that appears not to be. Little lag in this coming up. That the little circle is going round and round, so it's trying to pull it up. There on your screen in paragraph G, and again, this is an Ohio Medicaid rule. It talks about Ohio, the Medicaid community mental health services other than health home must be documented in the ICR and meet the progress net requirements. And then health home service shall be documented as necessary to establish medical necessity, and then it makes a reference to where medical necessity is. So again, there's that flexibility. There's that flexibility for providers in how to document the service. A progress note might be applicable in one session, and in another session, it might be a physician's notes or prescriptions or documentations of phone calls. And again, hopefully the flexibility is a good thing, and it makes it easier for you to just document as you see fit and rather try to meet a regulation that's very prescriptive. I have a question on the de-identified information, and I don't know the answer to that, so I would refer you to the Office of Health Integration if you don't have their email address. Again, I've got Rob's back up on the screen. Feel free to send the email to him, and he will forward that on. That's right now. I don't have any new questions. Seems like it takes people. It's kind of like me in the morning, slow to get started, but once I get going, I guess I start moving a little bit faster, and questions kind of slow to start coming in. All right. Well, again, I know I've said this before, don't have any more questions. Nobody has their hand raised. I'm going to go ahead and end the webinar. Thank everybody for participating, and if you've got more questions or if you just want to listen in next week, next Monday, again, time change from 1:30 to 1 o'clock, and we've got it set aside for an hour. They usually take an hour to 30 to 45 minutes. So have a great week. Goodbye.